Thanks, Tady, and thanks to the organisers for asking me. I'm looking around this room and I suspect a lot of you probably know nearly as much as me about asbestos and the risks that it poses. So it's a little bit difficult for me to craft a talk that will suit all of you. But as Tady said, I want you to ask questions at the end. There's plenty of opportunity to do that, so write them down if they occur to you. The one thing I will say is I'm not going to comment on any one person's particular situation because that would not be appropriate, but I'm very happy to answer any general sorts of questions that you might have. As all of you know, asbestos has been one of the disasters of the 20th century. The reasons that make it such a good product, the fact that it is impervious to chemicals, impervious to heat, pretty much indestructible, is the same reason that it causes lots of problems in the lung. Here's an ad from just after the war in Australia, and it says, "Don't dream, build. Your guide to building beautiful new style homes of Hardie's Fibrolite." And that, of course, is asbestos cement. The figure is that in Queensland after the Second World War, 75% of new houses were built of fibro. I once asked David Malouf, you know, the author, who wrote lovely stories about Queensland and Brisbane, about how he felt about the wooden houses in Brisbane and how he felt when they were being pulled down and oftentimes brick monstrosities being put up in their place. And he said, you've got to understand, people in Brisbane were actually quite ashamed of the fact that they had wooden houses because we didn't have the money to put up stone houses or brick houses. And the wood house was seen as a cheap alternative. So, then when fibro came along, even cheaper than wood, and after the war it was hard to come by wood, never mind stone or brick. And so you can understand why this new, rigid, easily shaped product became very popular in Queensland. And we'll come back to what's called the second wave of asbestos problems that we're now encountering. Just some basic facts. You probably know lots about this. Asbestos is made out of very common substances in the earth, magnesium silicates. So a mixture of magnesium, silicon and oxygen, which in and of themselves are pretty harmless. The problem with them is their shape, and in particular that they're long, thin crystals. They come in a couple of basic types there, serpentine and amphiboles, and it's the crucidolite, the blue asbestos, which is particularly dangerous. As I said, they're tough, they're heat and chemical resistant. You can weave them into fabrics, so they're really very, very useful product. Their short, straight fibres are more dangerous than the curly ones. And the problem with them is that they can't be cleared or dissolved in the lung, so they stick around in the lung for a long time. So here's some pictures of the crystals, and there's the crucidolite here, and that's the really dangerous one. One of the problems with crucidolite is that when it gets stressed, it fractures, but it doesn't fracture straight across the crystal, it fractures lengthways, so it splits into longer and thinner fibres, which go all the way into the lung and through a mechanism which is a little bit unclear, gets through the edge of the lung and ends up on the lining of the ribs outside the lung. And that's where a lot of the problems come from. Thady mentioned that one of the factors which drives the toxicity of these substances is how long they stay in the lung. And in experimental models, it takes 7 years for half of the fibres to be cleared from the lung. And that's in an experimental model. In actual life, they obviously hang around a lot longer than that. So, if everything went according to plan, it would take more than 40 years for a fibre to be cleared from the lung. In the meantime, they get bound up in scar tissue and so they can't get out. And that's why crucidolite is so much more toxic than chrysotile. They're both dangerous, and we don't use them anymore. I think most of you know the Wittenoom story. It's here's a picture of some, this is the mine, open cut mine in Western Australia, and you can see some workers here bagging the asbestos, and you can see the dust all around them there. It was discovered by Lang Hancock, father of Australia's richest woman, I think, and he named it after his partner on the Mulga Downs station. They began mining in 1937, and I guess in a pretty smart way, he sold it to CSR in 1937. Till the 1960s, it was Australia's only supplier of asbestos. And I guess as an example of the public health disaster that asbestos is, there were many, many people over 20 years, chief among them Eric Saint, who was actually the Dean of the Medical School in Queensland, who kept saying to CSR, this is highly toxic stuff, you're going to end up with problems, and they paid no attention. And there have been multiple hundreds and hundreds of deaths in the people who worked at Wittenoom and in the families who were the passive recipients of the asbestos dust. So you're probably aware asbestos is seen in thousands of different products. There's a list there that we don't need to read, just to demonstrate how ubiquitous it was in Australian industry and in particular in manufacturing. And there below are the jobs that where many people got exposed to asbestos. And I don't doubt that some of you here today worked in those categories. All of these individuals would have asbestos exposure. But you know, it was so ubiquitous in our society that round about 20% of people who end up with asbestos disease, particularly pleural plaques, have no known exposure. And whether they were exposed to random dust in the air or from maybe servicing their car and doing the brakes or some other thing that they'd completely forgotten about, it has been so ubiquitous. So this is a house made of fibro. The asbestos cement sheeting contained chrysotile until the late 1960s, and crucidolite until the late 1960s. The danger of that was understood, but they still persisted with chrysotile until the 1980s. And I made mention before of the second phase epidemic. That's the epidemic which is developing now of people who've been home handymen and women and who've drilled and cut and sanded houses such as this one, which is, I think, in Townsville. So that's the second phase epidemic. The paradox is that fibrocement is relatively safe if you leave it alone. So it's safe unless it's decomposing, and you can see the Super 6 corrugated sheeting here on the roof, exposed to sunlight and variations in temperature. Over 20, 30 years, it will start to flake, and the asbestos fibres will become detached from the concrete. As long as the asbestos is bound into the whatever the background material is, it's relatively safe because it doesn't get out. And it's only when it gets out and becomes a fibre floating in the air that it's a problem for you. So it's safe unless it's decomposing, unless you're sanding it, drilling it, sawing it, bashing it, or knocking it down. And painted and sealed fibro is particularly safe, which is why if you live in a fibro house, you don't need to stress too much. You just don't need to touch it. And if you are going to do something with it, pull a wall out or something, you need to get expert advice to contain the dust so that it's not a risk. So asbestos and lung diseases, there are a range of lung diseases. They are not all asbestosis. So you're going to leave here today understanding that asbestosis is only one form of asbestos lung disease, the scarring of the lung associated with asbestos. That's asbestosis. There are lots of other forms of asbestos lung disease. Pleural plaques, which we'll come to, is the commonest manifestation. That can change into diffuse pleural thickening. Benign pleural effusions are collections of fluid between the lungs and the ribs, which are not associated with cancer. They tend to occur relatively early in the course of asbestos exposure, often around about 10 years after the person's been exposed. There's a form of scarring which is associated with pleural plaques called round or rolled atelectasis. That shows up as a big round shadow on an ordinary X-ray or CAT scan and can sometimes be mistaken for a lung cancer. And sometimes people end up having lung biopsies of this round atelectasis. In actual fact, particularly on a CAT scan, has characteristic appearances and doesn't need a biopsy if those appearances are present. So asbestosis is the lung scarring, the damage to the lung, which is associated with high levels of asbestos exposure. And that's what Bernie Banton had, as I understand it. Mesothelioma is the cancer associated with the lining of the lung, and it's almost always caused by asbestos exposure. Mesothelioma is cancer of the lining of the lung. And Dr. Cole's going to talk to you about that a little bit later on. And then we also know that in people who smoked, there is a multiplier effect with asbestos and cigarettes. So the two together give you a much greater chance of getting cancer of the lung, not of the lining of the lung. Cancer of the lining of the lung is mesothelioma. This is primary lung cancer, like people who smoke get, and the asbestos fibres will accelerate that process and put you at even higher risk of getting lung cancer. So that's 1, 2, 3, 4, 5, 6, 7 different ways in which asbestos can damage the lung. Now, I think it's really important for us to understand a little bit about the logistics and mechanics of getting lung disease from asbestos. It is a dose-related phenomenon. So if you breathe in 1 fibre of asbestos, the chances of anything bad happening to you are very low, which is why it's safe to live in fibro houses, particularly where they're sealed, as long as it's not decomposing. Increasing exposure is associated with increasingly sinister disease. And the vast majority of people, happily, who have some asbestos exposure are down the bottom of this triangle. Now, the problem with mesothelioma is that although it's dose-related, there's no plateau, so there's no dose which is safe. Very small doses give you a very small increase in the rate of mesothelioma, and I'll show you some numbers to demonstrate that. But most people have relatively minor exposure, and their risk of getting anything serious is really quite low, which is not to say we shouldn't take the whole matter very seriously, but I think we have to put it in proportion, and what we don't want to do is have lots and lots of people desperately anxious about what is pretty trivial and low risk exposure and consequences. So I said the commonest sign of being exposed to asbestos and a sign of having breathed in asbestos is asbestos pleural plaques. This is a chest X-ray, and this is the right lung, that's the left lung, this is the heart in the middle here, that's the diaphragm on the right side, diaphragm on the left side, and this funny shaped shadow here is a plaque, which is to say a plaque is just a fancy word meaning plate, and so this is a plate of scarring, and in this case with some calcium in it, in the middle of the lung, on the edge of the lung. It's actually on the rib side of things, in the middle of the right thoracic cavity. You can see some other little marks here. Here's a little plaque sitting on the diaphragm. There's probably another one just here, and there's some other patchy shadows here. So plaques are circumscribed, that is to say delineated areas of thickening of the pleura on the rib side of the lungs. They develop with time and get thicker. What I say to patients is this is a bit like putting a grain of sand in an oyster. The grain of sand in an oyster is irritating. The oyster can't get rid of the grain of sand, and what it does is wall it off and put a little, makes the pearl around the grain of sand to make it safe within the oyster. And in some sense, a plaque on the edge of your lung is the same sort of thing. So asbestos fibre ended up on the inside of your ribs, and the body dealt with that by putting scar tissue over it, and then it gets calcified and shows up, gets little bits of bony stuff in it, and shows up very clearly. So it's very common. It takes 20 to 30 years to calcify and become more visible. 7%, so 1 in 15 people in a random series of autopsies in Sweden had some pleural plaques, much less often in chest X-rays. They indicate asbestos exposure, and they occur at levels lower than, much lower than you need to get asbestosis and with a very small risk of mesothelioma. Now, there's been contention over the years as to whether patchy plaques can cause problems or not. There have been issues about whether they cause pain or not. The consensus is that plaques by themselves don't cause too much trouble. Plaques per se do not cause mesothelioma or lung cancer, but they are an indication that you've had asbestos exposure. And the more plaques you've got, the more exposure you've got, and therefore the more likely it is you're going to have some difficulties. So here's a study from Sweden, which looked at some Swedish asbestos workers, 624 individuals. Within 10 years after their exposure, nobody had any pleural plaques. And you can see here, after 20 years, 10% of workers had them, and by 50 years, more than half of the individuals had visible plaques. So they develop with time. This is a slow process. I showed you a chest x-ray before. That's one way of picking up pleural plaques. Scans are much more sensitive, so this is a cross-section through the chest. This is the heart, and you can see the heart in the middle there. And again, at about 1 o'clock on the right-hand side, you can see that white thickening there, and that's a plaque, and you can see a number of other little knobbly bits around at maybe 1:30 and down here at about 4:30 and up maybe 7:30 and up at around about 11. There are some other pleural plaques. So this is somebody with widespread but discrete plaques, and we wouldn't expect this person to have any illness whatsoever. There wouldn't be any limitation of their lung function, they wouldn't have any symptoms, and it's just a marker that this person has been exposed to asbestos. Mesothelioma is the really feared complication of asbestos exposure. And this is something that Chris Cole might see when he puts his telescope inside somebody's pleural cavity, and he'll show you other pictures like this. In the middle of the picture there is an asbestos pleural plaque, and I don't know if you can see it around it in any detail with the light that we've got, but those red, lumpy, heaped up areas is where the cancer is, where the mesothelioma is. I wonder, are we able to turn the lights off, Katie, do you think? We probably don't need them. There's enough natural light. Maybe we can turn them off, particularly when we come to show you the video a bit later. So that's a plaque and that's a mesothelioma. So it's quite natural for people to think, gee, I've got a pleural plaque. Am I going to get a mesothelioma? How often should I have an x-ray? Should I have an x-ray every year looking to see if I've got a mesothelioma? The answer is probably no. So here's another study 20 odd years ago now. Plaques are a marker of exposure, but that exposure can be very low. So here were 1,600 men with pleural plaques followed for 10 years. In that time, 9 of that 1,600 people got mesothelioma. The number you might expect in the population as a whole would be about 0.8. So yes, the pleural plaques indicate an increased risk of mesothelioma, and there's 11 times the risk, but the absolute risk is still really small. Thank you very much for that. The absolute risk here you can see is only 6 per 1,000. So if you've got pleural plaques, depending on how many you've got about 6 chances in 1,000 of getting a mesothelioma. So yes, it's higher than the population who don't have plaques, but the absolute risk is really low. And my advice to people is that you don't get x-rays unless you've got symptoms. Have an x-ray, maybe have a scan, see if you've got any underlying, any lung disease as well. But once that's all been sorted out, you shouldn't have x-rays unless you've got symptoms. It just generates worry all the time. So what about plaques and asbestosis? As I say, asbestos pleural plaques are a marker of exposure. So these were 175 naval dockyard workers who would probably predominantly be working with lagging, used in insulation around boilers and around steam pipes and so forth, maybe in soundproofing. 10 years later, 1 in 4 had diffuse pleural thickening. So that's a really bad form of asbestos pleural plaques. 10% of those had changes associated with early asbestosis. And there's some clinical signs there. They had crackles, which are a sound like Velcro when you have a listen to the lung with a stethoscope. And interestingly, listening to the lung is more sensitive than an X-ray in detecting asbestosis. Not a scan, but certainly than a plain X-ray. So this is someone's CT here, and this isn't just a few scattered plaques. You can see here this person has got widespread areas of plaque formation around here. Oh, that's better. And around here. And you could understand how this person's chest has now been wrapped with a scarred, calcified ring around the outside. And this person might well have difficulties breathing and have some breathlessness. So diffuse extensive plaques can restrict chest movement and result in symptoms, but scattered plaques probably don't. So to move on to asbestosis, this is what the X-ray looks like. So again, this is the heart in the middle here. This is the right lung, that's the left lung, that's the collarbone on the right, collarbone on the left. And it doesn't project all that well, but what we're looking at is too many shadows at the bottom of the lung here and too many shadows in the middle and lower zone of the lung. Plain X-rays are not a particularly sensitive way for looking at a scarring of the lung, and CT chests are much better. So asbestosis is progressive lower zone scarring at the bottom of the lung. And that may lead to restrictive respiratory failure where the lungs simply can't move in and out enough. It's dose related. And a rule of thumb, and these are very loose figures, is that there's a term called fibre year. So you need to have around about 100 fibre years, which is 100 fibres per mil of air breathed in over 1 year's work, so a 40-hour week, a 40-hour week for around about 48 weeks a year. So that's kind of the amount of dust exposure you have to get asbestosis. And just to give you an idea of what 100 fibres per mil looks like, if the person doing the laundry was shaking dusty overalls with asbestos on them in a confined space, the amount of dust in the air there would be about 100 fibres per mil. So it's very visible, but it's not completely choking the air. So it's a lot, but not a huge amount. And unfortunately, as with all the other, most of the other asbestos diseases, there is no specific therapy. Here's a CAT scan appearance of somebody with asbestosis. So to orient you, this is, again, slicing through the person like they were salami. This is the front, that's the back, that's the right side, that's the left side. Here's the heart in the middle here. This is the big aorta descending down the back of the chest. Here is some relatively normal lung. And what we're seeing on the edge, this is called honeycombing, because you can see why it's called honeycombing. And that's scarring associated with asbestos exposure. You also get diffuse lines here in the lung. And here you see more honeycombing and scarring. And this is something called traction bronchiectasis. So these are signs that the lung has extensive scarring. Is this specific for asbestos? No, it's not. And there are a number of other conditions not related to asbestos at all, which can give you a very similar appearance. And one of the problems, if I see somebody who's got an X-ray like this, who maybe has had some exposure, is to work out, and I'm sure Thady and the folks at Turner and Freeman or whatever legal firm you go to work out whether your exposure has been enough to convince a court that that's the cause of your pulmonary fibrosis. You can get helpful stuff by doing biopsies, but we don't think you should have to have a biopsy of your lung to prove a work-related injury. So that's all I was going to say about asbestosis-related lung disease. I'll just briefly finish by talking about oxygen. In all of the, particularly the chronic asbestos-related lung disease, people get breathless. And one of the obvious questions is, when I go to hospital and I'm breathless, I get given oxygen. So wouldn't oxygen help me if I'm breathless? And I'm going to show you a little video. So this is, you can go home and look at this on YouTube. It's a YouTube channel called Smarter Every Day. It's quite an entertaining channel. I hate it because all of a sudden I'm looking at it and an hour's gone by and I should have been doing something else. But it's a really good, this is a very good one because it's very informative, and that episode was called "Why You Should Attach Your Mask Before Helping Others in the Plane." Like the cabin staff tell you, should there be a depressurization event and the yellow mask drop from the ceiling, always fit your own before you fit the person next to you. So they put this chap called Dustin in a low pressure chamber which mimics 25,000 feet. And what I want you to do is watch Dustin very carefully.
I need you to disconnect your mask from the right-hand side so that both of you get hypoxia at the same time, even with the mask disconnected. If you could do that for me. So if you'll drop your mask from the right-hand side, turn your regulator off. You can look at the surgeon's gloves. You can see that they are really experiencing gas expansion. How are you guys feeling inside the chamber as far as the gas goes? Feeling good. And so we're going to start this hypoxia demonstration. Whoever has the toy, if you want to use that for me. So what I'd like for you to do is to pick up a piece, hold it up, show everybody, and tell me what shape it is.
It's a triangle.
All right, so you're going to put it inside the box? Good.
Okay.
Next piece.
Another triangle. Another triangle. Circle. Circle. No, it's a cylinder. It's a cylinder. Cross. Across. Square. Square. It's another cube. This is a cylinder.
We also can see a little purple come around your nose and your lip area.
This is a star.
Now, before we do it again, let's put your pulse ox on your finger. We haven't done that yet. Let's try to check your O2 saturation and see what we're down to. You've been off oxygen now for 2 minutes, by the way.
Roger that.
Don, how you doing over there?
I'm starting to feel like I'm going to black and white and the Looney Tunes kind of thing. My vision is going into just a central spot.
All right, so Don, you can go back on oxygen anytime you want to. You don't have to stay off. I'd like to know what the O2 saturation is on your pulse ox there. What does it read now?
67.
67. Okay, so that's a critical area here where you need to start thinking about getting back on oxygen.
So who's ever been in hospital and had an oximeter put on their finger? Few people. His oxygen saturation is 67%. If that happened to you in hospital, there would be sirens, bells, whistles. You would be getting the MET call, the emergency call, coming running to your bedside because oxygen saturations of 67% is diabolically low. Now, I'm going to stop the video there because Dustin goes on and actually ends up with, well, that wasn't very clever, was it? Dustin ends up with sats of 63. But what was one thing he wasn't? He couldn't do the puzzle. Did anybody notice what he wasn't? He wasn't breathless. Why wasn't he breathless? Because low oxygen does not make you breathless. Low oxygen does not make you breathless. Conversely, if you're breathless, giving you oxygen will not make you feel better. And that's a really important message I want you to take home today and talk about in the community, that just because you're breathless, oxygen won't make you feel better. It's a very natural thing. Gee, I need oxygen to live. I'm having trouble breathing. If only I had oxygen at home, I'd be able to breathe better and my life would be better. The answer is it probably won't. It ties you down. You've got a cylinder or a concentrator with a long lead. You're stuck on this thing now. So yes, if you've got low oxygen, giving you oxygen may improve your life a little bit, may improve your mental capacity, it may help you to exercise a little bit, but it won't make you feel less breathless. And there are other things we can do to help you feel less breathless. But low oxygen by itself does not make you feel breathless, and giving oxygen doesn't relieve that. And that's because breathlessness is almost always a mechanical phenomenon. It's from the fact that it's hard to move your lungs if you've got asbestosis or pleural disease or whatever. So I'm going to stop there, and I'm very happy to answer any questions that anybody might like to ask.
Thank you, Dr. Bowler. Peter, quick question of Dr. Bowler.
Thanks, Tony. Doctor, is there an ideal climate for asbestos sufferers to live in, like dry or humid or hot or cold?
Okay. So is there an ideal climate for asbestos people to live in? I think the answer is no. You should live where you want to live, where you're closest to your nearest and dearest. Maybe freezing cold, wet places, which doesn't include us, does it? you mightn't want to live in Melbourne, I guess, or Hobart. But certainly I don't think there's any particular evidence that a particular climate will be good for you.
Las Vegas?
Yeah, why not? If you've got enough money.
Jean, quick question for Dr. Bowler.
What are the other things you can do to help with breathlessness?
Okay, so that's a good question. What can you do to help with breathlessness? There's a thing called the diving reflex. So the diving reflex helps babies be born, and whenever people dive underwater, they get this reflex. So cold stimulus to your face causes the diving reflex and will relieve breathlessness. So one of the really good things you can do is get a portable fan and blow a portable fan on your face. Some of them even have a little water container and make a little mist of water that blows on your face. That's actually quite effective at relieving the symptoms of breathlessness. Getting fit is really important. So pulmonary rehab can make a big difference. It won't cure your lung disease, but it'll make you be able to do more with what you've got. So that's a really important thing. And at certain stages of people's illness, low doses of narcotics can be really helpful. So buprenorphine patch, Norspan patch can be helpful in very low doses. And the one thing that won't be, and you'll all know now, is oxygen.
Ray, I think you got a question of Dr. Bowler.
Doctor, I'm not sure who I should be directing this question at, but I'll try you first. I've had open heart surgery to repair the red valve, which is the mitral valve. I have pleural plaques, atelectasis, lung shadows. At my last heart check, I've been informed that my lung is putting pressure on my heart, causing the blue valve to regurgitate, hence more heart surgery. I'm waiting for an appointment to see the chest specialist at Prince Charles. My question, is all this feasible? Is it common, or am I a rare case?
Ray, I said at the start I'm not going to comment on any individual's case because I don't know you enough and I might give you wrong advice and you might go and do something you shouldn't do. So if you're seeing a chest specialist, my advice to you is write down all of your questions, because often when you get in there, you can't remember everything you wanted to ask under the pressure of the circumstances. Write down all your questions, and I'm sure your chest specialist will be only too happy to help you.
Linda, quick question of Dr. Bowler.
Thank you. Last time we were at a meeting, there was a new drug out that they weren't going to give to the asbestos people. Is there anything on that now that people who have lung cancer are going to get this new drug?
I'm not entirely certain which one you're talking about. There are two classes of drugs. There are some antifibrotic drugs which are available now, one called pirfenidone and one called nintedanib. Thus far, they haven't been approved for use in asbestos-related lung fibrosis. I believe there's work going on. The second area you might be talking about would be immune therapy in cancers, and I think Chris Cole's going to talk a little bit about that. So we might defer the answers to those drugs in mesothelioma to him. If you've got lung cancer related to asbestos, then these new drugs are quite effective. So yes, there are some new areas.
Thank you, Doctor. And I think Phil has a quick question for you. And before I get to Phil, you mentioned pleural plaques, Doctor. Do you think they can cause chest pain? That's been subject of some discussion we've had at these meetings in the past. What's your take on that?
So I can't claim to be 100% across the literature, Thady, but my understanding is the current feeling is no, not for discrete, isolated pleural plaques.
My question's more around the pleural plaques again, and you were saying about X-rays. I'm thinking for the trades that are in, the areas that you had up there, carpenters, in the construction industry, would it be worthwhile having X-rays mandatory like they do in the coal industry every 5 years so if they do see that they've got pleural plaques, well then potentially they know not to keep getting in that area and exposed to what they've been doing in their job?
A good point, Phil. I think that the main issue is that there should be no asbestos exposure these days. So, yeah. The other thing is that, it takes a long time for them to develop. You saw that slide I showed you. I think I would be inclined to go down the same way as the silica-exposed people, that if you've got any symptoms, certainly you should have a chest X-ray perhaps, but if you've got symptoms, then you should have a high-resolution CT and some lung function.
Thank you, Dr. Bowler. Thanks for taking your time and coming out today and giving us such a wonderful presentation. I'd like to ask Phil Blair to come up just to give you a small present.
Thanks very much again for coming.
Phil's the chairman of the Asbestos Disease Support Society.